Welcome back. You're watching McLaren Port Huron's Today's Health, and we've been talking all about heart attack. In this segment, we're going to be talking about surgical treatment options, and joining us is our guest, board-certified cardiothoracic surgeon, Dr. Fouad Azoury. Dr. Azoury, welcome to Today's Health.
Good morning. Thank you, Barb, for having me.
When does open heart surgery become the treatment option for blockages?
Blockages could vary from patient to patient, and while most of the blockages these days are dealt with stenting without open surgery, however, we've got several blockages depending on the distribution of the blockages. Some patients have associated problems with valves that require surgery, and at that point, for a full fix, you would need open heart surgery.
And sometimes this is right after a heart attack, and sometimes it's any other time you have blockages.
Yes, you don't have to have a heart attack to require surgery. I'm sure our cardiologist will be talking about the warning signs. You don't want to wait till it's so obvious to come to medical attention. Any symptoms that are unusual in the chest, or even people think they have a heartburn, could be pointing to a threatening and impending heart attack. So certainly we urge everybody to see their doctors early, and surgery could follow. Would like surgery not to follow a heart attack where there's already some irreversible damage, and try to preserve as much as we can.
Can you give us a little overview of what actually happens when you do open heart surgery?
Well, that's a complicated question. Anyway, what I need to point out, and I hear it from patients think that we actually move the heart and put it outside the body, and that's not going to take place, and we'll go over the details. However, most of the time at this point, it still involves an incision in the middle of the chest or the breastbone. That incision could vary in length depending on the patient's body habitus. We have means to try to do the surgery through smaller incision from the side, but that's reserved for specific cases where there's one or two blockages in the front of the heart. Patient obviously will be out. You don't want to remember any of what's been happening during surgery. And the bypass part, I'm not going to talk about valve surgery. The bypass part involves basically rerouting blood to the vessels and to the blockages. And I use the analogy of adding a ramp to I-94. You've got issues on the highway, you're adding a ramp to it. We've got a heart model here that can help, maybe one picture can save me 1,000 words. And again, we don't do anything to the actual blockage. We don't go core out the blockage. All we're doing is using an artery from the chest, could be on the left, could be the right, could be both. We use sometimes arteries from the arm, and arteries have better long-term results than veins. And we also use veins from the leg that we basically reroute, and we take blood. As you could see, these are added bypasses. Whatever is flowing in the normal vessels is still flowing, and we'll be adding vessels that goes from the aorta, which is a major highway, to the small vessels. Bypassing, going beyond the blockage. That's very important to understand. Then eventually we close the chest. The common question is, what do you use to close the chest? And we use stainless steel wires or cables, and those stays in.
And about how long do the procedures take? Do they vary?
Definitely. It certainly varies depending on the number of bypasses and complexity. However, you're looking at a 4 to 6 hours surgical time. The trip could be longer because patients taken to the operating room earlier for preparation for surgery, and they could stay, half an hour or a little bit more to wrap up things after surgery and move to the intensive care unit.
We've had an open heart program here about 20 years. I'm certain there are many advances in techniques in that time. Can you tell us about that?
In bypass surgery, there are not too many advances or changes. However, what the audience needs to know that there's two ways of doing the bypass surgery. The most commonly performed way of doing it is obviously on a still arrested heart. So what we do in surgery, we actually reroute the blood away from the heart, oxygenate the blood, pump it back to the body away from the heart, stop the heart, and I'm going to mention again, we don't take the heart out of the body. And with the heart still, we perform our surgery using microscope. It's a microsurgical thing. It's a very technical surgery. And then once our technical work is done, just by letting the blood flow back to the heart would wake up. And we call that weaning. It takes several minutes to wean that heart. And once the heart is totally recovered now, we stop the bypass machine, and now the whole work is taken over by the heart. Now, another way of performing the surgery is what we call an off-pump or a beating heart strategy. With those cases, we don't use a bypass. There'll be no cannulas going to the heart. The heart remains beating and moving. We compare this to fixing the engine as the car is driving at 100 miles per hour on the highway, literally. And people wonders, how can we do that on a moving target? Well, you know, the industry helped us with technology to stabilize the areas where we're operating. It's a relative stability. It certainly takes some skills to still perform, you know, that microsurgical work on a moving target. However, it's doable, and we've proven that, and it's, you know, it's not that new. We've been doing this from the 90s, and not everybody is candidate for that. I have to specify that. The sicker you are and the more potential problem you are, you probably would draw more benefit if we can perform the surgery on a beating heart.
So the recovery time for someone after a major surgery like this would be weeks, I'm guessing.
You'll be amazed. You'll be amazed. I mean, the next day, most of the patients are sitting in a chair by bedside having a breakfast.
Really?
It's not going to be an Egg Benedict breakfast, but some type of breakfast. We get them walking that day or even the next day. It's 1 to 2 days in the ICU, then on the floor, 3-4 days on the floor. You're looking at around 1 week. And again, depending on what functional status you achieved, you either will be ready to go home, or maybe you would need some therapy and you might benefit from some rehab stay, and that could take place in a hospital setting or outside in an extended care facility for a couple of weeks just to get stronger. Some patients are strong, however, we encourage families to be around, and not everybody has family around. And if they're going to be alone, it's not really indicated. And those patients will advise for them to stay a couple of weeks in an extended care facility just to recover and get stronger and be less dependent. Patient is almost independent. They just need a presence around them.
Absolutely. Well, you know, when people, as you describe this surgery, everybody is thinking, boy, I want to be at a really good place where they really pay attention to the quality. Can you tell me a little bit about that?
Wouldn't you?
Absolutely.
We, here, at least at Port Huron, I can speak for this program, and you know, it's not a secret, we'll go to other hospitals also. We are a group of specialists that includes cardiac surgeon, very specialized cardiologists and cardiologist team, and a very experienced, and the support from our primary care physician and family practitioner and the internal medicine and the respective consultant in every subspecialty. We need the help of the kidney doctor sometimes, we need the help of the infectious disease, the neurologist. I could speak for the surgical part. We, as a group, have more than 60 to 70 years of combined experience, and we basically perform every cardiac surgical procedure. The only procedure not performed here, and it is only devoted to designated transplant center, is heart transplant. And those are, you know, minimum number of cases that we would refer out. We do the bypass part, whether it's on pump or off pump on a beating heart, all valvular surgery, including valve repair. We thrive to try to repair valves and then replace them. We do all major aneurysm surgery for the aorta. There are other specific surgeries. However, what I mentioned probably constitute 98% of the surgery we do. We have excellent results. We have a track record. People can look that online. This is public reporting and public data that is available to everybody. So we're really proud of what we have here. The message is simple. People don't have to leave the area. People don't like to leave and go out. If I want to have surgery, I would love to have my loved one and my family around me. And people really don't have to leave town. It's a one-stop shop. We can do pretty much everything in cardiac surgery or cardiology. We basically came to the patient because we can see if the patients don't want to come and don't want to travel hundreds of miles to get to a center.
Thank you so much for this great information and joining us today.
My pleasure. I hope this helps shed some light on the program and what we can do here.
Absolutely. And thank you for joining us. If you have any questions about anything we've talked about today, you can call Health Access. That's 1-800-228-1484. You know, you can always get physician information, a physician referral. You know, you can go to our website. That is just such a great resource. If you want to bump around and look at the heart services, you can go to mclaren.org/PH Heart. Or you can always just go to our website. You can contact us. You can watch any program that we have done, and that's at mclaren.org/PHTH. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron.